video. You might be a dental student, a pre-dental student, a dental hygiene student, a dental patient, but wherever you are in your dental journey, welcome to this video and I sincerely hope that you learn a lot about the field. So with that, let's talk about dental terms used every day in the field of dentistry. So first, let's get oriented with the mouth. Of course, we have the lips here that form the outer border of the mouth. We have the teeth, we have the tongue, we have the roof of the mouth, which is also called the palate, which is divided into a hard palate, which is towards the front of the mouth. It has underlying bone, and the soft palate, which is towards the back of the mouth and includes this hanging bit of soft tissue called the uvula. The tonsils are also in the back of the mouth and they serve as part of the immune system. Now we've separated the teeth from the previous diagram and the patient is open as wide as possible and we have the upper teeth up here and the lower teeth down here. And note how the teeth form an arc or an arch like you'd see in certain architecture. So we call this one the upper arch or the maxillary arch because the upper jaw that holds these teeth is called the maxilla, and we call this one the lower arch or the mandibular arch because the lower jaw that holds these teeth is called the mandible. Now we all have four different kinds of teeth. The first kind are called the incisors. We have four incisors in the front of the mouth for the maxillary arch and also four incisors down here in the front for the mandibular arch. There are two central incisors and two lateral incisors in each arch. These are used for incising or slicing food, like when we bite into an apple, for instance. Of course, the four upper incisors also play a big role in how our smile looks, and they help with speech, like F and V sounds, for example. The canines are next, and we have two of them in the upper arch, right next door to the incisors, and we also have two in the lower arch. They're also called the eye teeth because they're located in line with your eyes. They're used for tearing and holding food and also contribute to the aesthetics of someone's smile in the case of the upper canines. The premolars are next, and we have both a first and a second premolar in each quadrant of the mouth. So we have two premolars here, two premolars here, and then we have two and two down here. And again, we have a first and a second premolar in every quadrant of the mouth. They're used for tearing, holding, and grinding food. And lastly, we have the molars. So we have three molars in each quadrant of the mouth. We have a first, a second, and a third molar. The third molars are also called the wisdom teeth, and they're the most commonly missing tooth in the mouth. Molars are used for grinding and mashing food. I should mention that these are the adult teeth. So let's talk about the baby teeth. The baby teeth, also called the primary dentition, are shown here, and we have 20 of them in total. We have 20 baby teeth when all of them come in. There are four incisors per arch, two canines per arch, and four molars per arch. Note that there are no premolars in the baby teeth. These start coming in at around 6 months of age, and teeth coming into the mouth is called eruption. And all the baby teeth should have fallen out by at around age 12. Teeth falling out of the mouth is called exfoliation. Over on the right, we have the adult teeth, also called the permanent dentition. We have 32 of them in total. Of course, some people have extra and some people have missing teeth. These teeth start to erupt at around age 6, and then hopefully they never exfoliate as long as our teeth remain healthy. Alright, so I told you there are 32 adult teeth, but how do we number them? Well, there are three main numbering systems that dental professionals use today, depending on where you live in the world. The FDI system is used in most places in the world, just like the metric system. The universal numbering system is used in the United States, and the Palmer notation is used in certain specialties, particularly orthodontics and oral surgery. And I'll tell you why in just a second. Well, let's start with the universal system first. And it's just like reading a book. You start in the top left corner, which is this tooth right here. And then you go from left to right. So I want to point out really quick that this side is the patient's right side and this is their left side. Because remember, we're looking at the patient straight on. So tooth number one is right here, and that's the upper right third molar. Then we just go in order from there. Tooth number two, number three, number four, and so on. So we'd go around the upper arch until we got to this tooth over here, which is the upper left third molar, tooth number 16. After that, we jump down to the lower arch. That lower left third molar is tooth number 17. Then we continue numbering. The upper right central incisor is always tooth number 8. And so every tooth has a predetermined number from 1 to 32. For the Palmer notation, we break the mouth into four distinct quadrants. The vertical line straight down the center of the mouth is called the midline. This horizontal line is simply separating the maxilla and the mandible. The Palmer notation is a little bit different in that we don't go above the number 8 because each quadrant has 8 teeth. We start at the midline and work our way out. So the central and premolar will be 4, second premolar will be 5, the first molar, second molar, and third molar. And that's true for every quadrant in the mouth. So we could do this for every single quadrant. Now you might be wondering, well, how do we distinguish between the ones, the twos, and all the other teeth among the different quadrants? Well, notice how the lines intersect. So this corner forms a backwards L, this corner forms a normal L,